I'm Dr. Ben Kibler. I'm an orthopedic surgeon at Lexington, Kentucky, the Shoulder Center of Kentucky. I've been working with sports medicine, shoulders, baseball for many, many years, played ball myself. I work with the Kansas City Royals in the baseball field. I take care of Lexington Legends, which is the Royals farm team there in Lexington. I work with a lot of tennis players as well. Question comes up, what's a growth plate? What's a growth plate injury? Well, all of us have growth plates. They're different places in the body. What they do is they allow growth of bones. And the ones we're talking about here mainly are at the elbow and the shoulder. There's one that runs right across here around the shoulder. It's exposed to a lot of forces when you do this motion all the time. It actually puts what's called tensile loads or eccentric loads on this side right here. So it actually tends to open this growth plate up a little bit. And that puts a little stress on there and it gives you some pain as you go through the motion. The major one we're really worried about nowadays, however, is at the elbow. Right here at this elbow right here. This part right here, this is where the muscles and the ligaments, the Tommy John ligament, attached to the bone. So it's not really attached to the bone in growth, it's attached to this little growth point, which is a little bit of calcium. Then there's cartilage, then there's bone. Now the reason that's important is that the time when this growth plate is at the most risk of injury is just before it closes in growth. And that's usually in kids about 14 to 15 years old. The problem with that is that nowadays, with the way the baseball is being played, that's when some of the maximum velocities, the maximum time of play, maximum loads, all these things are going on his elbow. So what you'll see is three things. Either the growth plate adapts, and because you're not putting too much load on there, it doesn't tear apart. It can just rip in two. It can actually be pulled away. If it's pulled away far enough, you have to go in there surgically and repair it. The worst problem is in between because it'll stretch out. It'll actually get farther apart and you get some damage that will be there at the age 15, will not show up necessarily until 18, 19, 20, and that's when you get your Tommy John injuries right there. So now what are the things that we worry that create this problem right here? The first thing, the most important thing, is actually shoulder rotation. If you do not have good shoulder rotation, then you put more load on your elbow. So you need to make sure that you maintain shoulder rotation. What's the problem there? Get a growth plate injury here, get a loss of shoulder rotation, or just this motion right here. So you coaches should be looking at your players as they are developing at least 2 or 3 times a year, measuring their shoulder rotation. It's very important that they stay without losing motion right here, especially this internal rotation. This is where you get into trouble. Second thing is that you have to have shoulder and shoulder blade strength. If you don't have that, then you're out here throwing too much and putting too much load on the elbow too. Remember, this is the end of the line. This is, everything else here is where the engine is. This is where you get the load. And so you gotta protect everything through here to try to protect this right here. So if we got shoulder rotation, shoulder strength, then you have to worry about this right here. First thing you have to do is make sure you have good biceps range of motion. The way you can test that is have them come out this way and do this. Now, sometimes we'll have some tightness of the biceps. That, once again, will put a load on the shoulder, on the elbow right here. But the main thing is volume. Too many pitches, try to throw too hard, bad mechanics, those are the things that put the most load on the elbow. And those are the things that will get you in trouble. What are those factors? From the science, we know that throwing more than 10 months a year is bad for your elbow. You need at least 2 months off, preferably 3 months off from throwing in game situations. You need to use that time to improve your range of motion, work on your strength, develop your mechanics. All those things are very important. Questions about curveballs and sliders, everything. Sliders probably bad. Until you get your growth plates closed, sliders probably pretty bad. Now, curveballs, probably not. If you do it the right way. If you drop down to throw a curveball, you're gonna put stress on here. If you do it right up here, then it's probably not much of a problem. That's a teaching thing. That's in your coach's lap. Y'all gotta make sure you do that right. But the main thing is the number of pitches, the volume. If you have shoulder pain, elbow pain, your risk of injury to the shoulder or elbow is 80% higher. Pitching in pain, you shouldn't be doing it.
So Doc, we get a lot of kids that have a poor slot on their arm, their elbow's down. What's that doing when the elbow's down?
Okay, well the problem with this is that the elbow out here, the bones, this little bone right here, it goes into a slot in the bone and it protects the elbow. Down here, the ligaments and this little growing plate gets all the load on there. And so you got to keep them out of this position for as long as you can. Now the old dropped elbow, that's true. Dropped elbow means you're down here, so you're in this position for a longer period of time putting more load on the growth plate. So you want to stay out of the slow arm, where you open it up too much, where you're doing one of these. Once again, too much load on the elbow, losing your slot. Why do you lose your slot? Because you have weak muscles, shoulder blade, shoulder muscles, your back muscles, and you lose your slot. You drop down. That's where you get in trouble every single time. That's why you're supposed to be up high. It's supposed to where you hit your slot every time. Those are the major things that coaches, and you can see these. You can see the drop arm. You can see opening up. You can see the slow arm. You can see all these things. You can look and see if they're tight, and you can measure rotation. All these things are under your control. And with growing kids, they change, and the muscle strength changes, the range of motion changes, and therefore you've got to be on top of this throughout this 9-month season that you have. And let them work on the other things. Anyway, weighted balls, growing kids, there's too much evidence that shows that weighted balls do not help in terms of increasing velocity any more than a regular good program. And it does hinder you in terms of changing your motion and putting extra loads on there. So it's probably not a good idea for growing kids especially to be throwing weighted balls. Too much evidence, too many other ways to get the velocity, too many ways to protect your arm and still maintain performance.